Channel 5 Abuja. Well, on today's health segment, it is a very important health segment where we are dedicating it to raising awareness on sickle cell. You know, sickle cell has touched 1 out of 4 in Nigeria, and it has affected almost everybody. And today in the studio with me is Daniel Bowman. He is the head of operations at Brain and Body Foundation, and I also have Miss Peculiar. She is also the manager of programs at Brain and Body Foundation. You're welcome to the studio.
Thank you.
And it's good to have you. So the month of September is known to be the month for the awareness of sickle cell. So for people out there, can you enlighten us what sickle cell is before we dive into, how we can support them? How would we get to know what it is?
All right. So for those who do not know, sickle cell disease is a severe and painful genetic blood disorder in which a mutated form of the hemoglobin distorts the red blood cells into a crescent sickle shape.
Okay.
Yes, at low oxygen level. Now, the word sickle, for those of you who are into agriculture, is the farm tool that has the curve of the C that you use to harvest grains.
Okay.
So the crescent shape is formed with a C. So that's how the red blood cells are formed with people living with sickle cell disease.
Okay.
Now, the red blood cells for those living with without sickle cell disease is round and smooth, whereas the red blood cells of individuals with sickle cell disease is sticky and sickle shaped. And because of the low level of oxygen levels, there's a lot of blockage with blood flow, especially in the joints, which leads to
the pains.
Pain,
Okay. Okay.
So that's a brief explanation.
Okay. So what are the common symptoms you find in a person that has sickle cell?
Okay. Well, as much as there are many factors, what is most common is pain in the joints. You find that lots of them complain about pain over in the chest region, the arms, you have the elbows, their legs, their ankles, anywhere where there's a joint, like I explained. Because of the mutation of the red blood cell, there's a cause of discomfort and pain in the joint areas, which you find them being unable to walk. Most of them can't stand for long. Most of them are always struggling with some level of pain or the other. So the symptom of pain is characterized with sickle cell disease, amongst other factors that result from sickle cell disease.
Okay. So what are the common, I'm talking about the cure for sickle cell. Are there a cure for it?
As of now, I would say that we find that from modern research, bone marrow transplant has been one of the significant, what I say, quote unquote, interventions. I'm sure that there are still other research going on, and we're trying to see how we can find more ways to cure the disease. But as for now, the best way to manage it is, if you're not going to opting for the bone marrow transplant, is to manage the immune health of that person living with sickle cell disease. Now, how do we address that? At the foundation, from our work with the children living with sickle cell disease, we realize that most of them who come into the foundation are often dehydrated, and most of them also lack some level of vital nutrients that help build their strength. So we're not just addressing it as a blood disorder, we're trying to tackle it also as strengthening their immune system so that their body can as well help them fight whatever comes with the disease. So in other words, we're just helping them to build their immune system. And we've found good improvements with the life of these children that come into the clinic. After a few months, they come back and say they've not had any crisis. The severity of pain has reduced. So these are good improvements that we've seen from our therapy and what we apply at the clinic.
So, Ms. Peculiar, being the manager of programs, how do you come into play with this?
Okay, so on the foundation, prior to coming into BBF, which is called Brain and Body Foundation, I came across certain programs and our work and the foundation helping these children. So what I do is assist in the clinic, basically where we provide supplementary nutrients to the children. This supplements The one we have on ground is called Citamil, which is a combination of vitamin C, D, and zinc.
Okay.
So we distribute the supplement to the children, and we notice over time that this supplement greatly improve the quality of life of these children. I mean, we come into the clinic, we give these children the supplements. We see children that are greatly affected with pains, crises, very severe crises, and then coming back after a while, most of these crises have either reduced or stopped, and the pains are no longer there. So what I do is I help with the clinic, making sure that a lot of children come into the foundation. We meet a lot of children, and then we help give them the supplements.
So you're like a caregiver, sort of.
Yes, professionally,
So
not.
that's why I want to ask you this question. As an individual, how do I now support somebody with sickle cell and then help create awareness on how I can, help him reduce that pain at home?
Okay, so as an individual, you'll be very surprised that a lot of Nigerians don't really know about their genotype. So it is very important that awareness is created surrounding sickle cell disease to prompt people to go and make this test to know what their genotype is, because it is very, very important.
Yes.
And then when you come across a child with sickle cell disease that's probably going through pains, going through crises, you could help with nutrients, the supplementary nutrients.
What if you don't have it at hand?
And one way is to actually prevent this crisis. And one important thing is to make sure that they are always hydrated. Water is very, very important in the life of a sickle cell patient. So one way is to make sure that they are always hydrated. They stay away from cold.
So your foundation is dedicated to supporting those with sickle cell. So what's your success achievement so far?
All right, I'd like to say that with the kids that have come into the foundation, just to highlight our main campaign for this year, Project Sickle Cell Disease Nigeria. Okay. We have our collaborative effort with our partners, international partners, Embrace Kids Foundation, and Tackle Sickle Cell. Now, our goal is to see how we can provide free supplements, Citamil, talking about the vitamins that she mentioned, all right, to 2,000 children living with sickle cell disease.
2,000.
2,000 kids all across Nigeria. So it's a year-long initiative. And of course, we've had good improvements. Right now, we have crossed over close to 1,000 children now all across Nigeria living with sickle cell disease. And success stories, yes, we have patients who have come into the clinic and they've been with us for over a year now. And a lot of them, after 3 months, have come back saying there's no crisis. They've improved over time. Their quality of life and their general wellness has also improved. So we have case studies that we can share and say, yes, this thing we're doing is actually working. And we're appealing to the general public to look into what we're doing. And long-term effort is that the Nigerian government can buy into our initiative and enforce a policy that can be applied across board, where doctors, healthcare professionals can implement the use of these essential vitamins to addressing sickle cell disease. Now, so far, I would say that we're almost there in terms of reducing the numbers of kids living with sickle cell disease.
Okay.
Yes.
Okay. So before I let you go, Ms. Peculiar, your last word to the people out there about the month of sickle cell.
Okay, so like I said earlier, the sickle cell awareness is very, very important because a lot of people need to be aware of their genotype, be aware of what sickle cell is, what it entails, and then most importantly, we need the cooperation of not just the general public, but also of medical professionals, like you said. If we come together, to literally fight this disease, reach out to as many children as possible, help lessen their burden, provide more care, and just generally reduce the negative impacts that this disease sickle cell is causing in our society.
Thank you so much. Thank you for coming on the program.
Okay.
So We've been talking about sickle cell in, creating awareness to people out there, how we can support them, how we can be there for them. So it is the month of sickle cell. Please be supportive and, information. The knowledge you do have to know is know your genotype. We're going to short break and we'll be right back.